I do not agree and believe. Why I believe it, but it doesn't have to be. There are only 1 in 10 addicts make it. I remember we'd be in groups that, like, you see all of you around here? There's 24 of you. Only 2 of you are going to make it. Oh, shit. Well, fuck, might as well go out and get high right now. Fuck it. I remember that mindset then. You know why it's 1 in 10 people make it? It's because we're not treating them the way we need to treat them. The body, the mind, the soul, the spirit. That's exactly why treatment hasn't been successful. It's not necessarily the individuals, because as the professionals, of the people who are the ones of their path of career, because of their expertise in the field, we are given the grail of therapy to treatment or whatever to help these individuals. And last studies show that to be more successful at recovery, 3 things need to happen. And I'm sure it's changed now, but I completely agree, because these things were present in my treatment program that were no longer there and that many don't have. Well, first, CBT therapy, which is cognitive behavioral therapy, talk therapy. Next one is EMDR. If you haven't heard of EMDR, it's a great base. It's a great foundation to deal with trauma. EMDR therapy is great. And trauma-informed yoga. Trauma-informed yoga. I hated yoga. I was 300 pounds. I hated yoga. I used to get Friday school. I used to get detention all the time because I would skip it. And then I was forced to do it. And then I loved it because I healed a lot of trauma. So if you have those 3 things, you have a higher chance of success rate. I propose what I've been working on, it's going to give a greater chance. It's going to give way more than 50% of success rate. Guaranteed. I know that without a fact. And so when we look at labeling people, and we got to be really careful even what we put on to people. Oh, well, only 1 in 10 addicts make it. My drug of choice was narcotics, pain pills. Now, at the end of my addiction, I've never used needles or anything like that. That wasn't available where I was at, thank God. But my biggest thing was anything that got me up. You know what I'm saying? And so when I got clean off of pain medication, cocaine, and I was eating fentanyl patches. I didn't know you could do what they do now with fentanyl. I had no idea. Like, I was just like eating them like Band-Aids. I sure the fuck did. Those. I was on 16 to 17 prescribed prescription medications to get off that. I'm on none now. And I did that with a mental health provider a long time ago, sometime. So that was a step process. And that's only my story, okay? Majority of mental health medications, majority of antipsychotic or psychotropic medications, there's a common chemical. Now, the chemical changes names based on what it's added to, okay? So it's not the same name, but it's the same chemical. And what this chemical does, it calcifies our pineal gland, which is technically what it's called, which is even right here. It's actually more back, it's actually further back there. It's not even right here. But anyway, it's really small size. It's called our pineal gland. And it calcifies it like plaque gets on our teeth. That's exactly what this chemical does. It does that to our pineal gland. And so when I worked with this doctor, the doctor was one who said, Anne-Marie, do you want me to give you another medication so you can make your family happy? Because I went in there like, oh, my family, I'm having flashbacks. They say I need this. They say I need that, because. And she was like, do you want to get on another medication to make them feel better? She said, you're not crazy. You don't need any of these. You are not any of these things. You are very gifted and you are very spiritual and you have a lot of gifts. You're not crazy. Do you want to continue to work on getting off these medications, or it's your choice. Because that's what I want to. I don't want to take these things. I'm not me. And so it was a very long, slow process. But that was one of hundreds of people I've worked with or had as a as I was a client or whatever it was. That was one of thousands that even offered that possibility to me. Now, I'm not saying that's the thing with recovery. I'm saying is that we're not treating the whole part of a person. We're limited, and I'm just going to leave it there because, people like to take my shit and make it their own, even though they can't fabricate my authenticity and my true experiences that I had to actually experience, and that I continue to heal from, that a lot of people who are taking my content created for me. But anyway, and there's a better way to treat individuals, and I know there is, because I did it. And it was nothing I ever read in a book of any of my college degrees, nothing I ever read, nothing, no program I ever worked or marketed for or participated in, never addressed any of these things.